And today's topic is something very different, something you probably has never heard about it. The eye and the face kind of becomes very, very shrunken. And that is a cosmetic blemish on a patient's face.
So we have a story of a gentleman who came to us in his 20s. He was all this time living with that contracted socket. And somehow he got to know about, and then a customized ocular prosthesis was fitted for him. Got that prosthesis, the smile on his face was so gratifying.
An ocularist is someone like who makes artificial fingers, artificial feet. They make artificial eyes.
Yeah. And most of the time they are not able to make out which is the natural eye and which is the prosthetic eye.
It is so gratifying for a surgeon like us to give that result because this is a life-changing situation for the patient. Hi everyone, welcome to iTalk, a brand new episode. I am Dr. Fairooz, an oculoplastic surgeon.
And I am Dr. Shaifali, also an oculoplastic surgeon. Through iTalk, we try to bring to you topics related to eye, health, healthy lifestyle. And so here we are today with a brand new topic and a brand new episode for you.
And today's topic is something very different, something you probably has never heard about it until it has happened to you, or even, to those who has happened, they probably doesn't know what's going wrong. And the topic is an eye plastic surgery related topic, and that is called contracted socket. We have a socket in the eye, and we are going to speak about the impact of contracted socket and its, interventions in a person's life.
So before we begin and take you through real life stories and the things that we do for intervention, I would like to give an overview of what is an eye socket. There are certain unfortunate situations in which an eyeball has to be removed. It can be either because a person has an eye tumor in certain situations, because of some trauma, because of some uncontrolled infection. We call it panophthalmitis, endophthalmitis, when the eye becomes blind and maybe it is painful. These are the certain situations in which an eyeball has to be removed. And when it gets removed, we have an eye socket that now we have to deal with.
Yeah, so socket is the space, like I'll just show you. This is the space between the eyelids inside. It is lined by a tissue and it sits in this bone, we call it the bony orbit. Now, as Dr. Shaifali said, when an eyeball is removed, when an eye can be lost because of trauma, accidents. So once the eyeball has been is absent from there, and even by birth, eyeball can be absent. That particular area, empty area, we call it an empty socket. It can undergo shrinkage. It gradually shrinks, and the entire surface or that side of the eye and the face kind of becomes very, very shrunken, and that is a cosmetic blemish on a patient's face. This kind of cosmetic blemish relates to a lot of psychological trauma to a patient to have a good social life, be it, studies in a school, mingling with friends, finding a job, finding a life partner. So it really affects the quality of life and social, interaction of these patients, giving a lot of negative, social impact on a patient's life. And for the same reason, as an oculoplastic surgeon, I love dealing or intervening with contracted socket so that, it's just not giving them a good look, but it actually, makes a lot of positive impact in regaining the confidence and the quality of life in these patients. And that is what contracted socket is. So we can actually prevent contracted socket.
Yeah.
Prevention
Because we always believe that prevention is better than intervention. And there are certain steps that should be taken right from the beginning to prevent a socket from being contracted.
So when we talk about prevention, in any disease, I think, as a physician, we should always consider prevention as the primary and the crucial step. So how can we prevent the socket becoming shrunken and contracted is whenever a person loses an eye, that is, the volume of the eyeball is gone from the socket, it should always be replaced, 100% replaced. When something goes out of a socket, a similar volume has to come into the socket. And that's when an eye plastic surgeon puts an implant. It's like a ball implant of different material. We have different material, good quality implants, which will be like a ball. Obviously, there is no vision, but then we put it so that the surface of the socket doesn't contract and shrink, cause severe cosmetic blemish. And that is how we prevent it. But there are situations, even now, despite the advances in the implants that's available, that surgeries of, eyeball removal or after loss of an eye is ignored in replacing the volume. And I think as an oculoplastic surgeon, it is our responsibility to raise this awareness among our peer groups, surgeons, physicians, that whenever an eyeball is removed, it should always be replaced by a volume inside. And this can prevent in future of contraction of the socket. Yeah, and yes, we do have so many real life stories, and it's just not acquired. The person from Mysore, like he was born with it. Yeah, I mean, I think you should share that story.
Yes.
Yeah.
So sometimes in acquired situations, we'll be talking about that also. But sometimes you're born with the loss of an eye. That side, the eye has not fully developed. We either call it microphthalmia. Micro means small, or anophthalmia, meaning there's an absence of the eye. So since there's no trigger in that space for the things to expand, that side of the eye space will be contracted. So the person is born with it. So we have a story of a gentleman who came to us in his 20s. He was all this time living with that contracted socket.
Yeah.
And I think he had a story about people bullying him in school, and he was still tolerating it, and somehow he got to know about that there is a solution that exists for his situation, and he landed up with us. And I remember how gratifying it was on the final day. After he had undergone obviously stage surgeries. We replaced the volume through a graft taken from his own body, and then a customized ocular prosthesis was fitted for him. And the day he got that prosthesis, the smile on his face was so gratifying. And I think he shared pictures of himself with his friends and group. And because earlier his complaint was whenever he goes out, he can't take selfies. He's too shy to go out with his friends. And that is how his life transformed by these surgeries and intervention techniques.
Right. Yeah. So obviously the patient finds it very gratifying, after, a face which is kind of shrunken, which is psychologically affecting them. It is so gratifying for a surgeon like us to give that result, because this is a life-changing situation for the patient, from where they have had a very low self-esteem of, that cosmetic blemish on the face. And I'm sure, even getting a pimple for a teenager or, anyone at whatever age, it bothers them. So just imagine, one, you're losing an eye. That itself is a psychological trauma. We empathize how much the patient and the family feels when someone loses an eye. And on top of it, you're not intervening, you forgot to intervene with it, and then, the socket is shrunken and the face looks very, very distorted. So as a surgeon, I think I love dealing with contracted socket and the patients with contracted socket. It's extremely, extremely gratifying. So this is a patient who actually was born with the situation, but we often come across patients who have, acquired contracted socket. So this was this gentleman who met with an accident, educated family. He's aware of what is going on around, but, unfortunately, when he lost his eyes, obviously, the surgeon emergency would have thought about, saving his life, where attention was not given to the eye socket and it was left empty. And for many, many years, it started shrinking and shrinking and shrinking, where this started affecting him psychologically. Although he's good, he's doing well. But then it affected his work, mingling with social, interactions. And finally, I think he in fact saw a talk of mine
Yes.
online on contracted socket, which mostly no one knows, but he was searching and searching for it, and finally he landed up with us, and we completely reconstructed, put pieces in the puzzles into place, gave an implant, gave a volume. And apart from us as oculoplastic surgeons, someone who really is involved in this entire process is an ocularist. We work hand in hand. So as a surgeon, we reconstruct, we give a nice space, we put the volume, we create a nice, spaces over it. And then the patient is assisted by the ocularist to make an artificial eye shell. And that artificial eye shell is measured, it's color matched with the original eye, and then it is fitted in these areas, which is built by a reconstructed and restored by an oculoplastic surgeon. So it's actually a team game between an eye surgeon, a plastic surgeon, and an ocularist. An ocularist is someone like who makes artificial fingers, artificial feet. They make artificial eyes, the
ears
prosthetic
sometimes,
ears, so it's a hand in hand, teamwork. As you said, congenital, where the people are born with contracted socket. We had the youngest that we dealt with an absent eyeball would be
I think less than a month.
27 days.
Yes.
Yeah, 27 days. So this gentleman came in his 20s, but earlier you refer these cases, it's easier for us to mold it, expand it in a baby. And I think she got her first, near naturally looking eye prosthesis when on her first birthday. So it's easy to expand in a baby, and they have to be really early referred for intervention and expansion. And that is what we do. And it's really gratifying. It's a beautiful journey. It's a difficult journey, but end is beautiful.
Yeah.
Yeah.
And I remember this gentleman that you were talking about. He was so surprised to see the work of the ocularists also. I remember like the time that he was there, because it's always custom made. It's kind of like a day's process that they take the size, the color, the tiny vessels of the eye also is like matched and colored. And he was like amazed at the work that went behind. And he kept saying that I didn't know this existed, and now this has changed my life. Of course,
not many people know about it. Now, when we talk about the eye shell, there are ready-made shells available. People who have gone through this journey might be relating to it. You just go, you kind of match it. There will be like lots of colors and shells available. And that's called ready-made prosthesis. But ready-made prosthesis is not good for the socket. It's not fitting well. It finally is an ill-fitting prosthesis, which is not customized and custom made. It keeps on rubbing to the surface. And that could be a cause for eventually in future for the socket to be contracted. So we never advise to go and buy something ready-made and randomly put something inside the socket. Socket is so precious. If you keep hurting it, it gets hurted, contraction. It gets hurt and it gets contracted. So we should avoid such things because technology has advanced. Surgical skills and talents are amazing. We believe that. So we have solution for it. And that is why we chose this topic here. Because in eye plastic surgery, this is a less known topic, and that's why we chose it.
Recently, we had a gentleman, 78-year-old gentleman, who probably underwent the surgery in his 20s because of trauma. And from then, very handsome, yes. And in fact, he was telling that he wanted to be in the movies, but just because of that, he could not be. So from that time onwards, almost for 50 years, he was wearing a ready-made prosthesis, which what we call as stock eye. And of course, because how Dr. Fairooz was explaining, the more the lining of the socket is hurt, it's under friction, it keeps contracting, and such bad contraction he had in his socket. So same, we gave him some steroid injections for preparing him for the surgery. Then we replaced the surface for him with mucous membrane.
So mucous membrane surface is like, we have to match a tissue which is extra, which resembles the tissue in the socket. So the tissue of the mouth, that's called the mucous membrane, is something which matches that area. So we take a graft from the mouth, and then we put it in the eyes, and then stitch it and make the space. And then finally, because he was wearing a stock eyes for many years, which was ill-fitting, it has caused so much of friction in the socket and it was contracting. But at 78 years of age, he still didn't give up. And we were so happy to help him and bring back that smile in him, and for this journey beyond.
And just last week he was fitted with the customized ocular prosthesis, and so happy. And even now he can, I think, probably try it.
I had a patient in Kerala, Amardeep. She was 81. 81, and she had this very bad discharge and stuff because she was wearing a small prosthesis. And so she came in, she walked in, and obviously, I gave an option that we might have to go for surgery for this to look much better, or we make a customized prosthesis in whatever it is. So the kids were like, how can Mama go for a surgery? Let's just go for the easy path. But she was kind of, adamant, like, I want to get it done in the right possible way. Give me volume and make it the most prettiest looking eyes. And she was clear at 81 years of age. So, it's just not a 1 month old or a teenager or in 20s or 30s. Patients who have lived with it for many years, they actually understand the value of, restoring it into a near natural look. When we talk about contracted socket, there is a range. We have mild contracted socket, and we have sometimes very severe contracted socket. Now, there is a contracted socket where various surgeries has been done, it has failed, and those are difficult situation, where we kind of, take a deep sigh and still don't give up on that and try to restore as much as cosmesis as possible. Of course, as surgeons, we are not God. We want to heal the world as much as possible. So we try our best to give the best outcome in these patients, and it's truly gratifying.
And eye is all about restoring the vision, but this is such an important part. Although the vision, obviously, we are not able to restore here. But as you said, psychological impact of this situation is so much there. I remember you telling me 2-3 of your patients in China, they used to grow their hair and to cover this side of the eye because they had contracted
the
socket
hairstyle
and
is changed, like Shaifali.
Yes,
so they
like
would
this.
just take it, they would just hide it here, so that they don't want people to know, So recently I think there was this. It was in the newspaper, so I don't mind revealing the patient
Middle
also
East,
in the
story.
Middle East, Dubai. So she was a nurse. She was living with it for many years, and then accidentally, some accidents are happy accidents. I just saw her walking by and I'm like, why? And she's like, no, I just don't want to see. I mean, I've lost it. Then I had to explain to her that this can be done and reconstructed. And she was so happy, and she was so happy. She never knew that this could be done. And she herself says it's like a life-changing situation for her.
And I know, like, whenever the patient with such situations walks in, we always cover the eye and ask them which one is the natural the natural eye. And most of the time they are not able to make out which is the natural eye and which is the prosthetic eye.
When we show the patients the
pictures, Yeah, so
pictures.
we don't show the picture of the socket, but we show it with the customized ocular prosthesis. And actually, you cannot make out when you see a person if he's
Yeah.
wearing a shell.
Yeah. So, well, thank you for listening to us regarding a very, very rare, not so common topic, that is contracted socket, which is dealing with it is very gratifying for us as surgeons, and obviously extremely gratifying for a patient as well in restoring the structure and beauty of the eyes and the face.
Yeah. And as we already discussed, prevention is so much better than intervention. So right from the beginning, if unfortunately eye has to be removed, I think from the first step itself with the right surgery, fitting the right customized ocular prosthesis from the beginning, I think can prevent socket from being contracted and give you near natural appearance, restore your confidence, and make you lead a happier life.
Yeah. So, losing an eye itself, we understand, is a trauma, and rehabilitating it is our responsibility as surgeons and giving you a better life. Thank you so much for listening to us.
Thank you. See you.